This short video is going to give you an overview of what syphilis looks like. Syphilis is a majorly chronic disease and is divided into primary, secondary, tertiary, and latent syphilis, all of which have different clinical manifestations. Let us first look at primary syphilis. This occurs after exposure to the bacteria through sexual contact. It mainly affects the genital area, that is, the penis in males and labia or cervix in females. It starts by forming a papule, which ulcerates to form a characteristic feature of syphilis, the hard chancre. It is a painless, avascular, indurated, and circumscribed lesion. Almost all other ulcers are painful, but syphilitic ulcers are painless. This is a standout point you really should remember. If you see the word painless ulcer in a question, you should think of syphilis first. It gives out a thick exudate that is rich in spirochetes, which are the causative bacteria. It also causes non-tender swelling of the inguinal lymph nodes, which is very often bilateral, that means on both the sides. It is important to remember that this heals spontaneously, that means without any medication, in 10 to 40 days. However, this doesn't mean the syphilis is cured. After being asymptomatic for 2 to 6 months, secondary syphilis sets in. This is the most infectious phase of this disease and is caused by the widespread multiplication of treponemes or the causative agent in our bloodstream. Secondary syphilis is characterized by a copper colored maculopapular rash which is present all over the body, including the palms and soles. This can even spread by the simple action of shaking hands. It causes the growth of flat, wart-like lesions in the genital and perianal regions, which is called condylomata lata. Generalized lymphadenopathy is seen, along with characteristic intraoral findings called mucus patches. These are multiple, painless, grayish-white plaques found on the oral mucosa. These lesions also heal spontaneously without any treatment. Usually, after decades of initial infection comes the stage of tertiary syphilis. This is majorly chronic and it is characterized by very few spirochetes. It causes the formation of the famous syphilitic guma or chronic granulomata, along with cardiovascular aneurysms and meningovascular manifestations. In the advanced stage, we can see syphilis affecting the nervous system, which causes neurosyphilis, also called quaternary syphilis. This is characterized by tabes dorsalis or demyelination of the posterior columns, which leads to general paralysis of the insane. Intraorally, firm nodular guma may ulcerate, leading to perforation of the palate. This form of syphilis is definitely debilitating, and even worse, it can be fatal. The last stage we look at is that of latent syphilis. The infected person lacks all clinical manifestations that we just discussed. However, they do have a history of primary or secondary infection. These individuals test positive for syphilis when we perform serological tests on their blood. It is of utmost importance that you remember such individuals can still spread the infection. In the early latent stage, sexual contact is the most common mode of transmission. This infection can also be spread from a mother to a fetus, which can occur all through the female's reproductive life if proper antibiotic treatment has not been administered. The best way to prevent infection is to always practice safe sex and never forget to use a condom. Stay tuned to our channel to know more about syphilis and its treatment. For more